We were all very interested in the program from the very beginning. It seemed too good to be true.
Originally, I was a little scared about not encouraging patients to use our own organization, but I learned from hearing patient phone calls how excited they were to have this service.
My name is Ruby Montgomery. I have 4 children. Then I take care of my mama. She's 87 years old.
My name is Lisa Capers. I have a husband and 3 children. My life is hectic.
Several patients that we actually listened to personal phone calls for were excited that they were paying relatives $20 to drive them to a local Walmart, and now their medications were delivered to their doorstep.
My name is Lucius Cook. Well, basically I had to catch somebody, get someone to take me there. Some of my nephews caught a cab or something to go there. It's just remarkable to have mail order for to come to the house, straight through the mail.
It's kind of like having a personal assistant.
I don't have to really worry about the medicine because they call me. She'll say, well, Ruby Lee, my medicine come today. And I'll be like, well, Mama, yes. And I'll say, but I ain't talked to nobody. I said, well, Mama, they called me.
Listening to these patients who were so grateful and honestly relieved when the service was offered to them and when they signed up was the deal sealer for me.
Once we knew that every T was crossed and every I was dotted, we pretty much jumped. When people don't feel well, their entire livelihood is affected. Providers at large can give a patient a prescription all day long, every day, day in and day out. If a patient does not have the ability to fill a prescription at a reasonable cost, then they will continue to do what they consider the best route for them.
I got a bad tendency of going to the hospital, going to the emergency room. I got a real bad track of that. So this helps me a whole lot.
I was forgetting to get my refills done, and I was only reminded because my numbers were up high. I'm getting sick or I'm going to the hospital. So this really does help me out a lot.
We are in Sumter, South Carolina, which is in the Midlands of the state. We are medically underserved. And so a lot of our clientele live in rural parts of our county.
Transportation is one of the biggest barriers to medication therapy in many of the counties that we serve. And having to not rely on someone else or worry about transportation to get their medication is a huge benefit.
Sometimes I don't have a car. Sometimes with grown children, they have the car and stuff. And then sometimes Mama can't find other people to go and get it. So it's much easier for it to come to the house, so you won't even have to go out, especially with it being hot like this.
It has been overwhelmingly successful. It's a huge benefit to our patients, and it has just continued to grow beyond our wildest expectations.
Based on our federally qualified health center status, we are able to purchase the medications at a reduced price. And we use those savings to bring the funds back into our organization.
Our ability to use those cost savings and put that back into service is significant. It enables us to grow as an entity, provide additional services, and ultimately see additional patients.
It changed my life a whole lot. So I ain't got to worry racing and go out and get to the store to find out what I need, and the medicine's right there. It frees me up a whole lot for do a lot of more things.
And on top of my family, I have recently decided to go back to school. I'm not only focusing on my education, but I am focusing on my health right now. As a result of this program, I've lost 30 pounds because it puts me on a schedule.
It helps a lot because keeping up with everybody's stuff is very hard. So they keep up with Mama medicine.
This isn't like the corporate third-party mail order services that you're going to receive anywhere else. This is a personal business that provides care to their patients on a one-on-one basis, and they get to know everyone at Equiscript on a first-name basis, and they look forward to those phone calls every month.
I would advise anyone who has the ability to use the Equiscript home delivery pharmacy program for their patients to most definitely use the program. Your patients will love the service, and in turn, you will love the ability to recognize the additional cost savings and revenue